Right, so let me introduce my guests and let's get the show underway. And my guest this morning, Abdul Malik Kubako, is editor-in-chief of the New Crusading Guide newspaper. Clara Berry Kasati is a lawyer and teaches the law at GIMPA. Dr. Anthony Nsia Asare is Director General, Ghana Health Service, and will soon be joined by Inusa Fuseni, MP Tamale Central and Ranking Member, Legal, Constitutional and Parliamentary Affairs. That will be for the very first segment, the first hour, when we deal with the matter of the $12 million drones for blood and essential medicine delivery. We'll have a second segment in which we'll be joined by Patrick Yao Buama, MP Okaikwe Central and Deputy Minister, Sanitation and Water Resources. Ladies and gentlemen, good morning and welcome to Newsfile.
Good morning.
Right. And I'm particularly excited that Dr. Anthony Nsiasare is here so that we get to interrogate the matter of the drones in a manner that, bears all the facts. So here is the matter, simple. The government has taken a decision that we have problems with some, our health sector. And part of that problem is how fast we can get essential medicine to certain parts of the country, which are sometimes inaccessible, and that people are dying because of the delay in sending medicine, including particularly blood. So the decision has been to sole source, the minority has a problem with that, to sole source for a contract of $12+ million for drones to be used to dispatch and deliver these medicines. The minority says this is fraud. We'll soon explain to you why they have that position. Because according to them, some of the things that we are paying for, we can get for a quarter of the amount we are paying. Imani joins them to say that this is a ripoff. We'll explain all of that in a bit. So let's hear the minority and Imani on what they have to say about this drones project, and then we'll return to the studio to commence the discussion.
Let no one lie to the people of Ghana, obviously because the person has interest or something or things believes that this should go ahead. For this case, I am staging a one-man crusade against it, because I strongly believe that it is nothing but a ripoff. I've said it and said it. All what I'm pleading with His Excellency the President is for him to intervene, because obviously his deputy or the Vice President is leading this country into a path of unrighteousness. This is not going to be beneficial to the people of this country. We should stop it immediately. $27 million can improve our healthcare better than what we are seeing. I've done the analysis to you. It's $145,000 per month per distribution center. So basic calculation. Okay, so let me pick your calculator. I think these days in the years of ICT, you can do it. 145,000 times 12. So each distribution center per annum is $1,740,000 times 4. So in the course of 1 year, one distribution center is going to cost the state of Ghana $6.960 million. So $6,960,000. Okay, now 4 distribution centers times 4, $27,840,000. That is the cost on the Republic of Ghana. That is the cost on the Republic of Ghana. So I've thrown the numbers out there. I want them to come out with evidence from the service agreement that has been signed with them, that they are asking Parliament to approve and challenge the figures as in the document. Please, they are deceiving Ghanaians. And I've said it and I'll continue saying it, that this one me, Atufos, as a member of parliament, even if anybody at all agrees to support it, I won't support it.
This will make profound changes in the way we live. And as a country, we really should embrace technology. A lot of the times we think technology is this far-fetched contraption only for first world countries. Sometimes we don't give ourselves the benefit to realize that with existing technology, we can do exactly even more coming late to the game than even the first world countries are doing, because it allows us to leapfrog and solve real problems with technology, real problems that affect the ordinary people who are living in the rural areas, who don't have access to a lot of services. You may think, for example, of someone trying to put together, raise a mast for a telecom company somewhere through a forest. They need to put all this technology there, and someone gets a snake bite. We go to the nearest CHIPS compound, and there is no snake serum. Way in the middle of nowhere, and this person needs immediate attention. How do you get this snake serum to this person? Or a mother is delivering and is losing blood, and you need blood immediately to this mother, and there is no blood inside. So if you have a technology that can help a dying mother or someone dying of snake bite bring the medicine, it is something that is so important that we should grab and make use of.
If the Vice President takes leadership in ensuring that we have a system, or we develop a system that can ensure a quick and timely delivery of essential health medicines and blood to several places that hitherto are or have been inaccessible. And I think that you should be telling the NDC and the people of Ghana that the NDC is obviously ignorant about what this agreement is about, and that they should take their time and read and peruse the document. We believe that if they do that, they will get a better understanding, and they should not oppose just for opposing sake. Any ordinary Ghanaian who loves this country and who wants to act in the best interest of the country will come to the conclusion that this is a good agreement.
Welcome back, and good morning to Honorable Yunus of Seni.
Good morning.
Thanks for coming in.
And I join you in the Red Friday, even though I'm not in red.
I know. I know you have always been behind us.
Yes.
And when we came to Parliament, Osei...
Chairman's Bunso.
No, the Osei Wusu.
Osei Wusu, yes.
Was saying no one will hurry you guys to pass the RTI. And I was surprised because he's the same person Kojo Yankson interviewed. Immediately, they sabotaged the NDC from passing it. We had put pressure on you. You didn't pass it. When we're going to the elections, you felt the pressure and you wanted to pass it. And then they sabotaged the opportunity. Then when they came and it was put before them, he gave an interview and said, everything is cooked, it's ready. Nothing to be done about it anymore. Now, suddenly, we can't seem to pass it.
Well, you see, I join you because I feel ashamed that I'm part of the parliament for the last republic. I mean, for the last parliament and this parliament that has failed to pass expeditiously.
This will be the third parliament failing to pass
it. But conscious, deliberate attempts, serious attempts were made actually in the last parliament and this parliament. Now, what we are going to talk today about, the drone issue, clearly touches and concerns the right to information.
Okay, that's not the issue for discussion today. So, okay, Kukuwako says all issues. You know, he's a chief advocate for it. Like Akoto Ampao, like Ace Ankuma, and the Occupy Ghana, who have been a big part of the Red Friday. Of course, I was happy to see Clara also joining the Red Friday and being in Parliament House to advocate for it. Thank you very much.
The least we can do as a country, we all really need the information.
Right.
Yeah.
If we are to deepen our democracy, it's essential.
Okay.
Of course, people talk about the fact that the Constitution guarantees it, but as lawyers, we know how difficult it is to exercise the right that is granted under the Constitution. We need to make it easier for everybody to be able to get access to information so they can contribute to deepen the discussions and then the national debates that we will have to move ourselves forward as a people.
Great. And as a Catholic professional, I will be inviting you to the Catholic Professionals Guild's Thanksgiving Mass on Friday, the 5th anniversary celebration. All Catholic professionals are supposed to be coming together to, work together to achieve good goals. I'm supposed to play a key role on that event. I've been doing a whole lot of things in the course of the week, and this is one of them that I'll be doing the coming week. So, Dr. Anthony Nsiasari, we actually had planned to play a part of your voice on this particular matter. But now that you are here, we should hear from the horse's own mouth. Now, I have been reading documentation surrounding this drones project, and I discovered that Cabinet discussed it and gave approval sometime in June, July, and then there was a sudden speed in November only to get the national security to do some checks on it, particularly about the company, Zipline, and then its subsidiary in, is it Rwanda? Yeah, Rwanda. And they did that so fast and returned it. And within space of, days, you had gone to the PPA and procured the opportunity to sole source for this. Question being asked, number one, tell us what the real purpose is. Number two, why sole source? And then you should answer to the questions from the minority about this being a fraud. And Imani saying this is a ripoff. And we'll show you some of the Imani research and why this is costly and there's a cheaper means to do it.
Thank you very much, Samson, and good morning to especially our patients who are in the remotest area of Ghana, my district, and everybody, and all the hard-working health workers who are also working in such areas, and even in the cities where our hard-working health professionals sometimes we need a very simple, essential, life-saving medicine, and he will not get it. Something is true. We've been on this thing for almost more than a year now. It's not only June. So we approach the cabinet, and I'm very happy that His Excellency the Vice President understood the use of technology in healthcare delivery, and for that matter, the whole cabinet. And that's what we want to do.
He has been in the forefront of what you may say, creating a smart economy.
Thank you.
He's the one leading all the digitization processes.
Yes. And I believe that digitization is a way to go as a country. We have to take advantage of modern technology to improve the efficiency and effectiveness of healthcare delivery. That's the only way I believe that we can achieve universal health coverage in this country. We have all signed to the Sustainable Development Goals 2030. And this service that we are talking about, with the drones, or what we call the autonomous remotely piloted aircraft system, is going to do, it's already being done. But it's being done very inefficiently. Because as I speak now, if somebody is in Begro Hospital, I'm not talking even about a rural area. If somebody is in Begro Hospital and he needs maybe an O-negative blood, the patient is bleeding, and the patient needs it, and you can get the O-negative blood maybe at the Kolebu Blood Center. The patient will get the O-negative blood, but somebody pays for it. If the patient is lucky, the hospital may use a hospital vehicle to move from Begro to Kolebu, pick it, and go back, and the patient will be given the blood. You look at the time that it will take for the the hospital vehicle to move from Begro to Kolebu and back. But in most cases, it's the patient's relative who does this. The patient relative, by all means, will hire a taxi, move from Begro, come to Kolebu. The taxi will be waiting. The blood will be cross-matched and all sorts of things, and the blood will be given to the patient. There's a fee to the blood, the processing fee and the fee of the blood itself. The relative will pay for all these things and move with the blood to Begro to be given to the patient. If you are not lucky, by the time the relative reaches Begro Hospital, the patient is gone. Doctors and health professionals will be waiting. Sometimes, I'm a doctor. I've been a doctor throughout my life, throughout my adult life. I've seen cases where we lose patients, not because we cannot manage the patient, but because we don't have the essential things to treat the patient. And that is what we are talking about. So this service fee, which we are going to pay, is already being paid in a way by either the patient's relative or by the hospital itself. That's where we are going to fail. And we are not buying the drones. I want to repeat here. Government is not buying any drone. Government is going into a service agreement to buy the services that we are doing now through a company who, I will say here, I'm sure you will ask me about why sole source. I want somebody to tell us if there's any company in the world who is using drones to deliver healthcare commodities. So far as I know, it is only being done, we check, it's only being done in only one country in the world, and that is in African country, and it's in Rwanda. And if you look at Article 663 of the Public Procurement Act, it gives a way when we want to procure services that there's a single company who is doing it, or it's a specific thing that you want to buy. You can apply to the Public Procurement Authority, and the Public Procurement Authority board will sit and then approve it. And that's exactly what we did. So something, we didn't rush it through only in November. We've been working on it. There have been a committee formed through the Office of His Excellency, the Vice President. And this committee has been working. We have the National Security, Ghana Civil Aviation Authority, National Blood Transfusion Services, Ghana Health Service, the Ministry of Health, and then some lawyers who are part of it. And we have been looking at it, and then we come out of a service agreement. So this, what I'm holding now, is Ministry of Health and the Fly Zipline Ghana Limited Service Agreement. It is not a purchase agreement.
Okay.
It's a service agreement.
In 16th November 2018, request for approval for the engagement of a firm for the design, installation, and operation of an unmanned aerial vehicles, that is UAVs,
yes,
for the delivery of medicines and medical supplies to health facilities across Ghana through single sourcing procurement procedures. The Procurement Authority had expressed some concern, and they say that when you wrote to them on the 14th of November, they responded to you and suggested to you that they wanted you to work on the figures and bring them downward. They were seeking a downward revision. However, what you presented eventually rather had gone up.
Yeah, something I'll explain that one. You see, we ask, when the Public Procurement Authority asks us, maybe bring it downwards, the question we ask Public Procurement Authority, have you checked how much it costs elsewhere, where they are doing it already, at Rwanda? Do you have any benchmark? You see, Ghana, and for that matter, in this part of our world, we normally think that if you write anything, bring it downward, do value for money. But I'm a doctor. Value for money in life is not only about the money that you pay. It's about the cost of life, which is priceless. Something, if you lose one single child, a 10-year-old child who may need an essential medicine like anti-snake venom, maybe 2 ampoules.
Which is part of this
Which cannot be delivered. And the child dies before the child reaches where we can get anti-snake venom. Or if even the child we are looking for anti-snake venom, but anti-snake venom is in another hospital which is not being used, which may expire and thrown away. You can't put cost on it. So, as a professional, I have been seeing this thing happening over and over again throughout my 38 years of my medical profession. And that is what this technology, which has been practiced for the past 2 years in Rwanda, in a similar environment like ours, in an African country, the first country to do that. And then we go around the whole world, and they are the icon in this field. Why can't Ghana do the same thing, take advantage of it? And that's what we are doing. So when we did it, you see, people have been saying that it will cost us 27 million. I'm sure the person is looking at page 39 of the contract, something. And maybe I gave you something, maybe if you can project it.
Yes.
I will explain why the person made a mistake.
Okay.
Because if you look at the page, the 39 that he's looking at.
So production, if you can, at this moment, let's put on the screen the document that gives us the price permutations. Okay, it's on the screen, so go ahead.
Yes. You see, so if you look at it, the cost that even we sent to a public procurement authority was a cost for only daytime, 7 a.m. to 7 p.m., 5 p.m. in the day. But I said, if I remember, I particularly said that if we are going to use it for emergency, not for only blood, maybe you can say that in the night, if somebody needs blood in the night, what happens? If somebody needs an essential medicine in the night, what happens? So we added the night to it. And they said that if you want to add night to it, then it means they have to then add some figure. That's why we negotiated for the 8,000 to make it 88,000. And we went back to PPA again, that they should go and do value for money and check other prices and come and tell us, which they understand they are doing. Something. If you look at page 39.
Well, they say you gave a strong argument from the supplier's side.
Thank you.
For why the price had to go up rather than come down.
Yes, because of the night.
And they seem to suggest that, well, they don't have any other way to cross-check what you are doing, so they grant it to you. That's what they seem to say in the letter. But go to
so value for money. You see, if you look at what Honorable Atuforsin was saying, he saw that on that page there's distribution center 1, which is DC1. There's distribution center 2, which is DC2. 3 and 4. They will all be at different phases. If you look what we have projected, for example, something, you have phases, phase 1, phase 2, phase 3, and full operations. When it's full operations, day and night, it's 88,000. And when it's phase 3, that is if they are not delivering up to 70 to 100 per day, average, is 59,000. If they are delivering between 50 to 70, it's 27,000. If they are delivering up to 15 to 50, it's 11,000. If they are delivering less than 15, we don't pay anything at all, and we have what we call the ramp-up period. If you add all together, you see all the phases will not be at the same phase. For example, we believe that the first distribution center, which we will put, God willing, if Honorable and the parliamentarians pass it, we will start at Suhum. It will take 3 months in phase 1. They will be delivering, it's the first phase. They will be delivering averagely about 15 a day until we scale it up.
They'll be delivering like only blood?
Not only blood, essential medicine, and even essential non-medical consumables. For example, if you have an accident.
So they will do that 15 a day?
At least.
15 dispatches?
15 dispatches a day.
Okay. In Suhum?
In Suhum, that's the first distribution center. Then there will be the second distribution center. So they will be doing it for the first 3 months, and the second 3 months, they will be in the phase 2, where they will be delivering between 15 to 50. And then we also believe that in the next 3 months, so for the 9 months, they will be in phase 1, phase 2, phase 3. It will not be 88,000.
Phase 1, phase 2, phase 3 will cover where and where?
The phase 1, phase 2, phase 3 in one distribution center will cover, for example, Suhum, we have mapped out about 500 facilities that they will be covering. So they will cover all the 500 facilities from CHIPS, health centers, hospitals. It may even be possible that even a hospital, as I gave example, in Begro, needs the blood. So it's at the distribution center in the Suhum. Okay. They will pick it within minutes.
Okay.
And in the contract that we are signing, they will deliver it between maximum 45 minutes, 30 to 45 minutes they have to deliver.
Give us a full idea of the coverage area.
The coverage area, the radius, 80 kilometers radius. So they'll be covering an area of about 160 kilometers diameter. It will be the Suhum one will cover the whole of eastern region, including the Afram Plains. It will cover the southern and the middle part of Volta region, including the plains. It will cover the whole of Greater Accra. It will cover part of Central region and Ashanti region. Okay. That's the first phase.
All right.
The second phase, immediately that they start this phase, we are mapping out, doing GPS, and then put the second phase, maybe I'm sure in the middle belt. Then the third phase will be in the northern belt, and then one phase will be in the western part of the country.
Okay.
This is how we have planned it.
So is the graduation expected that at the final phase the entire country will be covered?
Yes.
Okay.
And this is what we are going to do. So if you see, Honorable Atoforsen did something, and I believe that he either did it intentionally for political gains, or he thought that nobody has read through the contract. If you read the contract, the figure that is quoted about 154, if you discount it 145, is for all the 4 centers. Why does it say that it's for one distribution center? And it's written something here. DC1, distribution center 1, DC2, distribution center 2, DC3, DC4. So why does it multiply it by 4 again? If that is his argument, assuming that that's how he's arguing, then if for every year we will even pay about 9 million Ghana cedis, because if you think that we shall be at the same phases as he has seen in page 59, 39, then we will not even pay the 12 million. Okay. So I've told them that they should go back again and read it. But the actual Schedule 2, which is in the contract, page 33, that is where we have explained how the payment structure will be like. So the page 39 is giving an example. For example, if you start in February or maybe in March, it will be 3 months. So only distribution center 1 will be working. And then you will be paying the distribution center 1 at phase 3. So if you look at it, there is only distribution center 1, which will be 48 months. But the contract becomes effective for the first day that the distribution center 1 starts working. So if you look at it very straightly, these other distribution centers will be one of them will be 41 months. One of the last distribution center will be about 39 months. So it is not true that we are going to spend 27 million. And secondly, it is not true that Ghana government is buying drones. Nobody buys technology nowadays. We buy the service of technology. We want to make use of the service of technology to fill in the gap, to pay for what people are paying themselves. And the beautiful thing about it is all His Excellency the Vice President, through his able leadership, then said that, Director General, can't we make the corporate organizations bear this cost at least for the first 4 years? Then I said, this is a wonderful idea. So we sat down together. They gave us a letter, and we sent a letter to the corporate organizations. And when we went and explained to a GNPC, they saw the sense that, look, this will be one of the most important social responsibility, especially in health.
So GNPC is paying for this?
GNPC is a major sponsor for this. They've agreed to give. We signed a contract with them to give us $1 million as a social responsibility towards the good people of this country for the next 5 years. We have approached all the oil companies. When I went to one of the oil companies to explain what the rationale behind this.
You have only $1 million available to you, a promise of $1 million.
No, I'm coming.
You're looking at 12 million, 12.5 million.
This is not 1 million for the whole 4 years. They are giving us 5 million.
Okay.
We have approached all the telcos. We have approached all the oil drilling companies. When we went to one of them, I'll tell you a story. He said, I should show him, we have a graph of some of the distribution centers. And he realized that they are operating in the Western region. They said, Doc, if we can put one in Western region for us, then everybody will know that where we are working, we are going to give them this. And I jokingly said that we shall put one and name it after you. But on condition that you take the full yearly or monthly cost. You say, why not? That this he thinks will be the thing that we can use it, and then they will see that what they are doing. So this is what we are doing. But after all, even if the telcos and all these companies are not paying, this is a bill that you are paying. For example, at the distribution center 1 at Suhum, which is going to serve 500 health facilities, If you divide, when they have full range, day and night, more than 100 deliveries a day, 88,000 divided by 500, if I take it like that, it's $175 a month, which is less than 1,000 Ghana cedis a month. And I think, and I know, because I'm the leader in the healthcare delivery. Every hospital spends more than that money, even for getting all this.
Okay, you take a breather here. We'll come to interrogate that a bit further with some statistics that Imani has shown us that indicates that we can spend a lot less in getting the same products and facility that you are embarking on. Let's hear Yusuf Saini. There are questions that the minority as a collective has raised. He has sought to debunk and clearly indicate how faulty or deceptive some of them are. What would you say?
Well, thank you, Samson, for this opportunity to be part of this very important discussion. A discussion about whether or not we need drone delivery of medical equipment to medical facilities in this country, as a discussion. Samson, the minority has raised issues, and the issues were raised because the document evidencing the service agreement was presented to Parliament, and the minority went through and saw that there were fundamental issues that had to be addressed. But listening to Dr. Osei, I become more I become more worried, because as head of the medical facility, he's not convincing us enough. Why, Dr. Nsiansari, you have been a doctor for so many years.
He's been an administrator also.
You have also been an administrator
of a major teaching hospital.
And you know that before you introduce a service, and you're a surgeon, you know that before you introduce a service, you need a baseline studies.
Yes.
What at all was missing in the service delivery infrastructure gap that ought to be complemented? You know that.
Yes.
In fact, the baseline studies will give you an opportunity to remedy the difficulties, the gaps that you see, not so.
Yes.
You also know that to be able to remedy the gaps, you must collect baseline data. How many people in the country have been suffering or dying by reason of absence of essential drugs? How many people have been dying by reason of the non-availability of the service? What are we going to do to be able to address those challenges? You know you have to have that baseline studies. Throughout the conversation, no one has told us exactly how many medical facilities that we have in this country. How many of those medical facilities offer blood transfusion? How many of those medical facilities have run into problems because of non-availability of drugs? No one. And how we are using this delivery to address that? No one has told us that. Okay. And I think that as a people, these are what we demand of public officers. Dr. Mahmoud Bawumia, the Vice President of the Republic of Ghana, ought not to have been leading this debate. And I've actually seen your communication in which you have mentioned the significant one, Dr. Mahmoud, as being the brains behind this whole thing, because he got you to constitute a committee. He got you, not the Minister of Health, but Dr. Mahmoud Bawumia got you to constitute a committee for the implementation of this. And I've also read the letter from Public Procurement Agency, and they appear to be playing the Pontiff Pilate. We have listened to you. We wrote to you in July, and we demanded certain explanations from you. You have come back to us in November. You have not answered. Indeed, from your communication, the figures are even going up. But you have found.
They didn't say they've not answered. They said they made strong arguments.
No, they made strong arguments.
From the supplier. Why the price should even go up.
You can read paragraph 2 for the general public. You can read paragraph 2.
Go ahead.
But What are they saying? They say that we believe that you have satisfied yourself.
Exactly.
Not us. Not PPA. But I thought PPA existed.
Okay, can I read? Can I just read it?
You can read it for everybody here.
At the board technical committee meeting number so held on Thursday, the 15th of November 2018, the board noted from the additional information provided that the cost per distribution center, which the authority had earlier requested for a downward revision, had rather gone up. We also noted the rather strong argument put up by the service provider to justify their pricing, indicating that the price offered to Ministry of Health is comparable to prices for similar operations in other jurisdictions. In the given circumstances, the board is of the view that the ministry and its stakeholders have satisfied themselves that the cost of the project will obtain value for money to inure to the benefit of the state.
Yeah, so it means that as for them, they remain unsatisfied, unconvinced.
Not exactly.
That's exactly what it means. Because the PPA does not exist to rely on the satisfaction of public institutions who apply to it for permission to source, either through competitive bidding or through sole sourcing. It doesn't exist to rely on their views. But Ajay, S.A. Ajay, has simply played the pontiff palette. Well, since you have satisfied yourself,
it's ABAJ.
ABIG, you can go ahead. No problem.
ABAJ is the chief executive of the PPA, and he signed that letter.
You see, Dr. Nsiah says that we got it wrong. Dr. Nsiah, indeed, you know that at page 21 you have indemnity clauses.
Yes. And
you know that the meaning of indemnity clauses are that you are, in effect, exonerating, removing, releasing the supplier from things that will occur under that indemnity clause. And you know that that will be cost if it does happen. You know that.
Can you give us examples what exactly that they have indemnified them against? So that when it happens,
Lord, you can
they will
even
not be
read
held
that. You can read that one. You can read 21. Indemnity is there. The company is so clever that they say, well, you have to indemnify us. And the range of indemnity is even more than the transitional provisions.
It's not standard indemnity. It's not standard indemnity.
Why? Is it standard indemnity?
Okay, so share with us. You are mentioning that, so share with us. What's the point?
The ministry agrees to defend, indemnify, and hold Zipline harmless against all third-party claims. So they insure them against all third-party claims related to injury or death caused by the erroneous administration of medical products, administration of expired or damaged medical products that should have been tested prior to administration, delayed administration of medical products, whether or not the delay was due to a third party, the Ministry of Health or a health facility, the non-administration of medical products, whether or not the non-administration was due to a third party, the Ministry of Health, and a health facility or Zipline. That's the indemnity.
And some of them not standard. So that if I delivered medicine for you,
I'm not seeking justification.
I'm just asking. If I delivered medicine for use and you didn't administer them, why should I be held responsible for it?
I'm not seeking justification for it.
Okay, please proceed.
Presently.
Okay.
I'm just saying that indemnity involves hidden cost.
Okay.
Probably that is not part of the 12.570 million you'll be paying. But that will be cost incidental to the operations of Zipline. and visited on the people of this country. Yes,
So
you
you see, I'm trying to help us to break down to our listeners and viewers across the world that, for example, they speak about expired medical medicines.
Thank you.
If that happens, it is the Ministry of Health's job to replenish them, and it's not their job. And if somebody is affected by the administration of expired medicine and so on and so forth, they should not be held liable. It should be Ministry of Health. You think this is untenable?
I didn't want to go to this address. This matter has been addressed in the service agreement. It has said in the service agreement that they will keep a warehouse, a facility, where they will receive deliveries from the Ministry of Health for stocking, and that anytime a medical facility needs a product, they don't need to contact the Ministry of Health. They contact Zipline by text, and Zipline will confirm the request and supply.
Right.
They also say that they will carry periodic audits of the medicines and blood available at their depot and remove expired products and blood. This is in the agreement.
Okay.
So, meaning they are taking reasonable steps to ensure that they won't transport expired drugs or blood.
But in the event that they do,
so in the event that they
held
do,
liable.
In the event that Ministry of Health gets them to transport expired products, they should not be held liable.
Okay.
That's what they're saying.
Is that fair or not fair?
Well, what I'm discussing.
We spoke about standard indemnities. Is that fair or not fair?
What I'm saying now is that it's fair. I don't know it's fair, actually. I don't even hold that to be fair. Okay? And I think that basically the power, the balance of power is very, very manifest in the indemnity provisions. It's very manifest. Now,
you supply me products. My job is to deliver to your citizens who need them.
I have no responsibility to ensure that those products are not expired. Is that what you're telling me?
Because you brought them to me to deliver it to them.
Samson,
meanwhile, I'll be conducting checks and audits
so
to
we
ensure
can't hold them for
being
contributory negligent. For supplying the distance. We can't hold them.
They are standard operation procedures.
No, we can't hold them.
No, I'm only asking you.
But you mean that in the event that they transport, knowing that they have said in the agreement that we will not stock in our warehouse expired products. They've said that.
Right.
Or blood. And then they transport products that are expired.
Yeah.
They should not be held contributory negligent.
You give me an item to pass on to Clara. So I take it. I give it to Clara. She suffers an injury. You say I should take responsibility for it, but not you who supplied it to me as a person who is just an intermediary to be able to carry it to Clara, because I am sort of, a transporter.
Well, there's something. This banal explanation doesn't do justice to what I'm talking about.
Okay.
I'm saying that the indemnity is so wholesale that it appears to exonerate Zipline of any culpability in the event that they could even be negligent.
Okay, so proceed to your next point.
The next point is simply this. And when you talk of capital flight, and a lot of books have been written about it. These days, it's simply about service. And that's why when you look at the EPAs or agreements that we enter into with development partners, they ensure that service should be part of agreements that will be liberalized. Because that is the way capital now moves from developing countries to developed countries. Because they develop the technology, patent the technology, and you pay for the use of that technology. And that's why we are worried. Now, what is that technology that we are talking about today? The technology is using unmanned area vehicles. You want remotely piloted aircraft systems, or commonly known as drones,
right,
to transport or move supplies. Okay. That technology is indeed a technology that is addressing delivery chain gaps in areas where we have challenges in the terrain, or in areas that are too risky to move those products by land. That's the service. That's the technology.
Or in case of emergency.
Okay.
Yeah.
What? Or
it's
very
important.
Or in case of I know
very important.
I'm ready to accommodate that one. Yeah. In case of emergency.
It's very important.
No, or in case of emergency. But that technology, the invention itself, had a mission, had a purpose, was intended to meet the legitimate expectations of customers in a certain area. And that area was simply an area where the terrain, you had challenges with the terrain, or where it was too risky.
Right.
So you fly.
We are talking about Rwanda.
Not even Rwanda. That's the technology.
Okay.
In fact, you recall
the only example they have, which national security also did some work on, is Rwanda. That's all.
The only example is Rwanda because it is only Rwanda that is using the service now.
Okay.
That's all. You have nowhere to go. You can't go even to America, to Silicon Valley, where the technology was developed, for any example. It's only Rwanda.
Okay.
The whole world.
Yeah, yes, it's only Rwanda. The whole world. So that's why they went to Rwanda. It's not as if to say that they had options. They had no options. In fact, I'm tempted to believe that what we're just doing is just simply copy.
That's what
we went to Rwanda.
Imani says that we are simply copying.
We went to Rwanda.
In Rwanda.
So in Rwanda,
and we are not looking beyond the facts.
The facts.
Okay, so hold on. So I'm getting to Kweku on. Interestingly, and you know, my gender advocates will say, why are you keeping the lady for the last? You just hold on and watch. He spoke about baseline. You took some notes, so yes. Pay attention to that.
Pay attention.
And now he's talking about the terrain, which is also a very important aspect of it. Rwanda, this is war. This is a place where you can say that the development is, you know, somehow. Okay, so Kweku, having followed the discussion so far, what are your views?
Well, you read my mind. Let me be honest with you. I really don't have a very sufficient, in-depth understanding of this matter. No technical or professional competence to deal with it the way I deal with other issues. I'll be very honest with you about that. But you read my mind. I've been tracking and monitoring the debate in recent times, but I've had the benefit of what we have just done here, and I'm convinced my brother Fusini and the minority have no case. Totally unconvincing. It appears that the agenda is just to raise issues. When the issues are answered, they raise new issues. They are engaged in what I call shifting cultivation. Here, totally, completely unconvincing. This thing about terrain, first of all, look, in terms of the infrastructure, yes, there may be lack of transportation. Even the road system we have, in terms of use, if you want to use transport, people talk of ambulances and all the rest, even the difficulty in transporting in terms of the road infrastructure, it's there, okay? We have thousands of health facilities across the country, some in very remote areas. How are you going, if there's an emergency, a patient's life may be on the line, minutes to save that. You're talking of ambulance to facilitate the delivery of that medical supply. You're actually signing the death warrant of that patient. So this technology is clearly a most efficient and fast-track option. And if it's available, you adapt it within the circumstances of your. Oh yeah, you can laugh. That's
I'm so surprised that you said that you have not answered the very question that we asked.
Which is
what has informed that decision?
Inform which decision?
Decision to bring in those.
Yeah,
but I've just told you.
You have not told me anything. You've just repeated, regurgitated what this man has just said.
Okay, thank
That's
you.
what you have done.
Thank you for
because I'm convinced by what this man said. Because
how many patients have died by reason
It's very
of
unusual of you.
I will answer you.
So uncharacteristic.
No, to say that the minority appear not to be useless and to pass a judgment on listening to us for less than 30 minutes.
Thank you.
It's so unfair.
Okay, thank you.
It's very, very unfair.
Proceed.
It's very, very unfair. We spend hours in looking at this.
I'm sorry if I've offended you.
You can't spend 30 minutes rubbishing what we have spent so many days looking at.
I am sorry if what I've done offends you. I'm sorry. It wasn't my intention to offend you. And you know that I don't do that to you.
I know, so I'm surprised.
I spoke my mind. I spoke my mind based on what has happened here. I'm clear in my mind that the position articulated by Dr. Nsiam makes more sense to me and more convincing. I have not insulted you. I have not insulted the minority. And I've actually established the fact that not that I'm professionally and technically competent to interrogate the issue in its broad base, but the little that comes to me, I am convinced that adoption of this technology, of this methodology, will help us to deal with issues affecting our health delivery care. I'm convinced. If there are issues about procurement, if there are issues about transparency, those must be brought to the fore and tackled. If you are talking of value for money and all the rest, we have to tackle them. Fortunately, public procurement brought in, cabinet brought in, parliament triggered in. Procedures and processes have been followed. But if there are still deficits, that's fine. Let's tackle them. Let's argue those cases.
Yes, so they are raising them. Particularly
but
value
I
for
say
money.
I'm not.
And the NPP, you know, I mean, they popularized value for money in the campaign.
In fact,
suddenly it appears from what the CSOs and others are saying that they are not doing anything different.
Well,
they actually
what is the
sounded
evidence?
as though single sourcing or sole sourcing was a criminal act, even though it was permitted by law.
But that's I took on the NPP
right.
in terms of the over-exaggeration of the issue of sole sourcing. I did, on this very platform.
You're right.
Okay, so I'm saying what the thing is in law is a law. It's there that you can do sole sourcing. At one stage, they created an impression as if sole sourcing by itself was criminal. I took them on.
What do you make of what the PPA is saying? That we think you are satisfied, therefore we approve. Even though we ask you to bring it downwards, you have come to give us strong arguments of the supplier, justifying even an upward, you know.
It is not unusual.
Increase.
I've seen so many PPA correspondence to that effect over the years. What it means is that they are saying at this stage, we are convinced, go ahead, we've given you the approval. That's what it means. If the PPA lacks the expertise, and they do lack expertise in some areas, like all other institutions of state, even the Attorney General's department, we all been talking about the need to improve on the skills, the knowledge, the capacity of the lawyers there. We know that. So I'm not about to suggest that they are so, everything that they deal with, they have. But what they have done, that letter you read, is an approval under the terms of the PPA mandate. It's an approval.
Don't you see them cleverly saying, if there is problem, we shall not be held responsible?
No, but the laws are clear. Did they go to PPA or not? Did they argue a case before the PPA or not?
Could the PPA, in fact, do otherwise when they indicate clearly that cabinet had communicated cabinet had indicated or approved this already, and they are aware of cabinet's approval?
Yes.
Could they decide to do otherwise?
No. Is cabinet approval a substitute for what is required of entities relative to procurement? Why do we go to the procurement authority? Cabinet does its work, and
the man sitting at the PPA rejects what cabinet has approved and hope to keep his job.
Oh, but what are you doing? You are inviting us into the realm of speculation. That's unfair. Let's deal with the facts as have been presented to us.
Okay.
If they didn't go to PPA, we'll be sitting here to take them on.
Right.
Because that would be an outright violation of the law. But they did. So they didn't seek cabinet approval as a substitute for the approval that you require from PPA. And PPA expresses an opinion. The opinion that you've read out to us, I haven't seen it, but based on what you've read out to us, is clearly an approval. PPA is giving a green light. After a strong argument canvassed by, is it the health, the Ghana Health Service and the Ministry of Health, I suppose?
Yes.
The PPA has given a green light. Proceed. So my view, really, unless somebody, look, the calculations Mr. Toforson was making, they're really like voodoo analysis. They were voodoo calculations. Here, as we sit here, they've been debunked, and in a more convincing manner. Unless somebody brings up evidence that shows this thing is a fraud, I think Ghanaians must vote for it. It will help in dealing with the healthcare delivery deficiencies and deficits that we have.
Okay. Clara, you have followed the discussion so far and the questions that have been raised. There are a number of questions that will still be raised. Particularly, I can only raise them to Dr. Anthony Nsiah-Asare. So what's your take?
Thank you, Samson. And I think today is President Kufuor's birthday.
Oh, that's
I think
right.
we wish him a very happy birthday,
Good one.
80th birthday. We are so very proud of him. Now, to come to the issue of the drones, I am hoping that this is one of the issues that as a people we can discuss dispassionately, devoid of partisan politics.
Right.
I think I have heard the arguments of both sides. The information that I think is missing, I think for the ordinary Ghanaian, what most are actually really interested in is to understand how this is to work and how this is to solve the problems that they encounter. If you have interacted with our health system in this country, you know that some of the issues that the issues you have on the ground are referrals, delays in referrals. And that sometimes it's just that the drugs are not there, the non-existence of drugs. And some of the issues are also the absence of personnel. I'm sure for people to be able to understand how this works, they need to understand how this facility how these problems will not end up sabotaging this facility. For example, if the referral system is still not addressed, communicating to the drone center might still be delayed. And even though the service is there, it may not be able to achieve for the people the problems that they have. Also, of course, the drugs must be there so that you can deliver. If the drugs are not there, there would be nothing to deliver. You must also, I believe, even with the drones, you still need personnel. You still need the required health personnel on the grounds to be able to take the drugs, to administer them. There isn't much information on this as to how it interacts with the drone system. I am pretty sure, I think generally, of course, technology must be embraced to improve our lives everywhere we are. So in principle, I am not sure that Ghanaians would kick against technology that is supposed to improve their health. But what Ghanaians would want to understand is that it will, in fact, improve their health. Rather than that, we would just end up having a system that is supposed to improve our health, but because the basic fundamental issues are not addressed, the ordinary Ghanaian still does not benefit. So I think more information as to how this is supposed to work, connecting it to the real problems that we have, which are really basic. If the community center is there, if you have a clinic and there are no personnel, you don't have the health personnel there, of course. Even having a drone is not going to solve the problem. There are also issues sometimes that you go to the hospitals and they actually don't have the basic facilities that they need to work with.
Right.
I am wondering, even if you are the drone is able to supply the drugs and you are still faced with that challenge, how that would be resolved, whether it would end up solving the problem that it is really intended to help to solve. So I think, if my view is that, like I said, in principle, I think most people would embrace technology if it is to improve. But if we are going to have an effective discussion so that this doesn't end up being hijacked by politicians and then it becomes a political banter, and then as usual, the rest of us just become spectators because we do not have access to how it works. I think the discussion, I think the Ministry of Health owes it to the people of Ghana to let them know how this really works. And this must be linked to the real problems. One, like I said, the referral system. The health personnel, do we have the personnel on site? How is this supposed to work? If they are affected, if somebody in a remote area is bitten by a snake, and then the drone is there to send them, how is that person going to be able to communicate to the drone center to have the medicine, the medication sent on site, and who is going to be there to administer?
Well, that one, they say it's a text message. You just send it to the zip line, the supplier, and then they will confirm with the health facility and simply.
So you still have to get to a health facility.
Yes, you must be in a health facility and be in need.
So there must still be personnel in the health facilities. And the basics must still be there. So I think we have to connect it to this. Like I said, I don't think just because somebody has done it, I don't, for whether or not Rwanda has done it, for me, it's neither here nor there. What is important for me is that, do we need effective delivery of health services? Yes, we do. But how is that going to be done in the context in which we have? So we still have, I have not heard a discussion on the basics, which is really a lot of the problem. Facilities. The existence of the drugs themselves. I think more information on how we are working to address this, to make sure that the drone does achieve for us what it is intended to achieve, would help us have a more healthy and useful discussion on this.
Now, Doc, a number of questions. You need to clear them as briefly as you can. And then we will take a break and return to deal with other matters that we have to discuss. But you see, the concerns that Clara raises, and part of those that Yunus Husseini raised, there's a surgeon in the US. He's written and asked questions, and there's a document that's attributed to him, Ayensu Dankwa. He, in his conclusion, asked the question that this drone system is really not the solution to the myriad of important life-threatening problems we have in our healthcare. When it comes to emergency services, the patient, the sick, the injured is much more important than the medicine or the blood that will be delivered, and therefore attention should be paid to getting the injured or the sick to proper healthcare facilities, either by ambulance, either by road, that's better ambulances, or more quickly by air ambulances, to enable them to receive the appropriate care. What Ghana really needs to begin to solve our healthcare is proper primary care services and education of the people, so that non-communicable diseases are brought to medical attention in the early stages, and not when it is often too late, as we currently have in our system. We also need to emphasize routine health maintenance, screening care. Doing these things will immediately transform our healthcare system. So he paints the example of where our vice president needs emergency care, and we airlift him, we take him out of the country to the proper facility. Where our deputy communications minister is in an accident and needs care, and we take him away from the points, from one point to another point, 37, where there is the facility to give him that, care, and says that the solution is not taking blood or medicine to that facility that perhaps, like Clara said, may not even have, qualified people in there.
Thank you very much, Samson. We have something we call health systems. What you are doing with this is going to strengthen an aspect of the health systems. health system, we will not have facilities throughout any country, even not in UK or US, where they are all stuck and then filled with health professionals and equipment to the same level. That's why in health systems, we have what we call referral systems. We have what we call the gatekeeper mechanism. So in Ghana, primary healthcare, is talking about primary healthcare system.
Right.
We are one of the countries touted to be one of the best in primary healthcare system through our CHIP system. So the CHIP is that we are taking care to a zone, to the community. And if you do that, we have the CHIP system, we have the health sub-district, which have the health centers, we have the district hospitals and the regional hospitals. Every one of them has an expertise, has a number of facilities and equipment and everything which is stocked there. What we are using this technology to do is to make sure that we support from the higher level the lowest level. And that's exactly what we are going to do.
Yeah, beyond the primary care, he's talking about part of it. He's talking about
I'm coming.
lack of ambulances.
I'm coming.
Or non-functional ambulances.
Ambulance.
In a country where the fleet of vehicles at the presidency are 50 times what you have in ambulances.
Ambulance alone doesn't save life. You can take an ambulance to a place. You see, people are talking. That's why I don't want the politics to come in. People are talking. But when you have an accident on a highway, the next available place they take you to is either a health center, even a maternity home. And if such maternity home, you need a pint of blood, not even a pint of blood, maybe you are an asthmatic, you've gone to asthmatic attack. The maternity home or the health center will not stock anti-asthmatic drug there because it will get expired. And then a system is in place where within a matter of 15 minutes, 30 minutes, we drop you such a drug. That is what you are talking about. That is what, you see, you are talking about a deputy minister who was taken from a place to another place. Yes, for a care, he has maybe a fracture. You don't fix fractures in even a district hospital, in a health centers or maternity homes. So this is what we are talking about. So it's not only about blood and blood.
Right.
And madam, we are doing what you call task shifting. I can tell you, we've done it in Ghana Health Service in such a way that family planning activities are higher in the rural areas than even in Accra. Because we have taught the community health nurses, the enrolled nurses, how to insert implants. This is what we call task shifting. So in this system, it's a total holistic system that we are going to do. So that if you drop something there, somebody is there who can give it, who has been trained to give it, and somebody sitting up in Accra or somewhere, through our teleconsultation system, which we have put in place, will then be telling the person what to do. And that person, if he's a surgeon, he takes full responsibility until the patient is taken to the next place.
So tell us about the baseline.
The baseline.
And then also, I mean, what's the rationale? Rwanda, there's a reason. What's the reason for Ghana's situation? And then I'll let you answer some of the questions Imani has posed.
The baseline, we've done the baseline. The number of maternal deaths, the highest cause of maternal deaths in this country is hemorrhage or bleeding. The woman who is in the remotest area, you saw a lady in all the social media who was carried on a motorcycle and then people were carrying the person. He needs blood. If blood has been dropped and that's where he is, he may not need to carry that patient through the river.
So the traditional birth attendants will administer blood?
It's not traditional birth attendant who's at
the remote areas,
no,
because we
it's
had
not,
a difficulty.
It is not
traditional birth attendants.
It's not traditional birth.
Yes, but we trained because we had a difficulty. We trained
traditional. You save part of your salary for chip compounds. Let's listen to him.
He doesn't know that now we have moved into another stage where we have chip compounds, where we have community health nurses.
No, I contributed towards the assessment of chip compounds.
So please, it is not traditional birth attendant who give the blood. We are talking about the chip compound or the health center where the blood can be given, where a trained person is there to be giving it. And I'm talking about, about 37% of the people. See, in Rwanda, when they did that, they delivered 13,000 blood in the remotest villages, and they saved lives. They've reduced their maternal mortality by about half. In Ghana, we are reducing our maternal mortality, but we want to strengthen it and make sure that this work is being done already. And two, essential medicines. People are dying from cardiovascular disease and all these things because maybe they need an essential medicine when they are in crisis. These are all things which will be delivered. So we have a baseline. Not that we don't have any baseline.
So you are doing this along ensuring adequate provision of things, the facilities that are needed, because there are districts where there's completely no health facilities.
Yeah, so we are working together. We are not doing only drones.
Okay.
Drones is, this is failing as a part of.
They are telling you that the amount of money you are pumping into these drones alone
over 4 years it's not money. Something
could get you so much.
Something. It's not money which is sitting with the Ministry of Health. It's money that we are already paying.
Okay.
But these services, we are going to make it more efficient and more
You see, you opened something. I thought that was the statistics you were going to share with us about the baseline study.
Oh, I didn't bring the baseline study statistics here.
So we have it in our annual benefit from.
Yeah, in our annual report, we tell people what kills the people, what are the morbidities, what are the mortalities. We have all of them. We also follow the data, how we are reducing it. We are reducing our infant mortality, maternal mortality. It has reduced. From, for example, our recent institutional infant mortality is about maternal mortality is about 109.75 as to 1.146 in the year 2016.
I think we will need.
So these are some of the things that we are doing. We can give it to you.
Figures behind this.
I can come and sit here the
to
next
properly
time.
understand the need for this introduction.
But something, there's a need for this introduction.
Okay.
What I'm telling you that we are taking advantage of information communication technology to improve the services and make it efficient.
Imani says there's a van delivery mechanism.
Yes.
And the van delivery mechanism, the full cost per 2 kilogram of blood, that's 4 pints of blood, delivered to a patient from a facility within 80-kilometer radius, comes to $0.75. The drone premium is nearly $18 per blood a bag. A cost higher than the retail price of 1 pint of blood in those Ghanaian facilities where blood is sold. Check this again. They say the cost of collection, screening, and storage of blood in the current Ghanaian health system is currently estimated at $12 a bag. The effect of the drone premium would be to increase this to $32 on average, a nearly 270% increase. Contrast this with a road-based hub and spoke model that would add a maximum of $2 with minimal loss of speed in delivery.
Something, I don't know where Imani did this calculation from. I know even the blood, when they are doing the testings and all these things, cost 100 Ghana cedis, apart from the cost of the blood. So if he's doing these calculations, he should have given us the source, where he got it from. And he should, I don't know where he got the 75 cents from.
Yeah.
I gave you an example. If you take somebody who is coming for blood from Bagoro to Kolebu, is it 75 cents?
That's your own expense in
it 4 cedis?
In hiring a taxi, you mean?
Yeah, is it 4 cedis? Even if he takes trotro, is it 4 cedis? So when somebody is giving this calculation, I've read it. He should come out and tell us. I know that he said that, for example, Zipline delivers 6 deliveries in a day, isn't it? It is. I don't think it's true. So now it's on him to give us where he got these figures and these things from. I can tell you, and I will say it emphatically here, that the calculation he's giving is all not correct. You should go to the National Blood Transfusion Services and get his calculation right. Giving blood and then doing the test is not 12 cedis, $12 equivalent.
Okay.
So it's not true. And then the drones don't take only 1 pint at a time. It can take 4 pints at a time if you need it. So the calculations he's doing.
The drones don't take what?
It's 1.75 kilos.
Okay, 1.75.
Okay,
and that's 4 pints.
Okay,
yes,
so
it can take a 4 pints.
Yes,
so all what Imani is doing, I'm surprised, because the author of what he has done is somebody who is a believer in technology.
Okay.
So when we are introducing technology to improve the service efficiency, and then he's bringing these calculations, so it's not on me. He has said it, so he has to prove to us where he got all his calculations from. But I can contest. I don't think it's right.
There's a question that is being asked that if the blood is refrigerated at the depot, you're going to create 4 distribution centers.
Yes.
If the blood is refrigerated there, what about the drone delivery box itself? Will it be refrigerated?
You see, whoever is saying that the bloods are...
Because the question is that from the videos of Zipline,
yes,
you would see that the blood is wrapped in a cloth and placed on the drone. And there is no refrigerator on the drone carrier.
Yes, when you pick blood from the blood bank, you take it from the refrigerator. The distribution centers will have refrigerators, which are built. The cost of all these things are borne by the company.
Okay.
And then they will put into an air vacuum type of box where they put things around it, fragile packages. When you go for blood from blood bank, if it doesn't take more than maybe 2, 3, 4 hours, the blood, when it even comes, you thaw it, you put it into water so that you come to room temperature. So they are not in a cloth. It is in a kind of air vacuum, so that when they parachute it down, it doesn't get destroyed.
Okay.
So we don't refrigerate the boxes.
Okay, when they move from the depot, where will the drones land? Is there...
The drones will land at the facilities at a place, so they parachute it. So within 5 minutes before they reach there, a text message or telephone call goes to the facility that we are about 5 minutes away. So somebody stands there, is dropped, and you pick it.
Somebody who is trained?
One of the health workers. Everybody will be trained.
All right.
Stands there and then gets it. And then it takes it and uses it.
Okay. Interesting. Yes.
But
if I can have you 2 minutes each, if you want to interact with him to better appreciate this, or you have any questions for him, let him address them and then we'll take a break.
Let me say something. You see, when Honorable Husseini was talking, you know, he never got into the calculation again. Because now I'm sure he's convinced.
I'm not convinced.
That they
no, I'm
did
not a
something.
man. I'm not a finance man.
No, it's not. This is not finance.
So now just listen to him.
This is not finance.
It's a wrong note to start.
This is not finance. So I'm sure you are now convinced. So you go and tell Atuforsin, who says he's not a finance man.
So hold on and listen to him. Hold on and listen.
I'm not a finance man. I'm just looking at the agreement.
In 2 minutes,
Doctor, you have 4 centers: Northern, Bronhafo, Western, and Central.
The only center which is now, we know the particular site.
We are going to have 4 centers.
Yeah, we are going to have 4 centers. Good. The only center that we are now.
And the drones will be flying, the radius, maximum radius is 80 kilometers.
Yes.
And where will Central be located? In Cape Coast?
I said that the only center that we have all agreed now is the Suhum Center. The second center, the third, and the 4th center, we will adjust it as and when.
Okay.
And so I was just wondering that we have one of the, and I spoke about terrain and the challenges of distribution. And I thought, taking it from the picture of the woman sitting on the motorbike, I thought that Afram Plains area ought to have been one of the priority areas for your consideration.
Yeah, I told you that the first drone center will cover Afram Plains. This is a pictorial, this is not it. But that's why I said that we have settled on Suhum to serve the first distribution center. And Afram Plains is part of it.
Afram Plains will be covered 80 kilometers?
Yes. Where we are putting it, it will cover. This 80, not land kilometers, air, straight.
Maybe from what he's suggesting, it is the case that the question of the baseline study you asked, they have a baseline study specific, determining this project.
Yes.
And in that project, the first place of priority should be Suhum. Yes. Is that what it is?
That's what we are doing.
Interesting. Okay, so let's have Clara interact with you as well.
No, I think I'll ask my question off air.
Off air?
Yes.
Oh, come on.
Thank you. So that we interact well.
But because it has to do more with the...
Forgive me.
Yes. But the question actually borders on the agreement, and because I don't want the discussion to prolong, you said it's a service that you are contracting. I was just curious as to whether you actually have an arrangement, you have negotiated a technology transfer arrangement that with...
Yeah, thank you very much. This is a very important question. We have negotiated technology transfer agreement. We've put in the agreement that they should have a training center within the 4 years so that we train our young people here drones. And who knows, Ghana may be the drone center for the sub-region.
I would be happy to see how that works, because I work in a sector where I know that we usually put technology transfer arrangements in agreements. Yes. We never follow through. So we always say that, okay, you are supposed to train this, and a lot of the agreements I've seen is there. The law provides for it. When it comes at the end of the transaction, we never follow through. So I would be curious to see how this will be different.
I'll give you an example. Those who went to Rwanda realize that now Rwanda is 100% manned by Rwandese.
No, I'm not talking. I'm talking about our situation.
And in our situation, already they have about 6 young people that they are working off: IT, engineers, pharmacists, and that's what we are going to do. We will follow it. It is in our SOPs, everything that we have done, and we are going to make sure that it's Ghanaians. The technology will be transferred to Ghanaians. The young men from Zipline, California, they want to set up these systems all over the world.
Okay.
So they want to do it and then move. They want to do it, hand over and move. That's what they are doing. That's what they are doing in Rwanda.
Okay. Will the agreement be made public so that we can?
Yeah, we'll make it public.
If it's online, then we can all have access to it, and
we'll put it online. We want Parliament to approve it, and then we'll put it online.
2 minutes with you.
Well, not 2 minutes, just a question. I mean, the certification process by the GCAA. Yes. What is the status?
The status is that GCAA have gone there. In fact, as I know, on the 4th of December, they wrote to the Honorable Speaker of Parliament, and they told Honorable Speaker of Parliament they've gone, they have looked, the range that they will fly and everything, and they are satisfied, and they will give the certification when the parliamentary approves them. So they are ready. A letter is there. Okay. I can share the letter with you if you like.
Okay. What do you say about those who say there was an original entity that was supposed to have done this business, but there was what you may say an unceremonious abrogation of that? I'm talking about Mama Help, not Zipline.
I'm not aware of that.
You're not aware?
No.
Okay. I've seen the correspondence.
I'm not aware of that.
Including, between the Ministry of Health and the Presidency also truncating this.
When was that?
It's sometime in October. Is it in February? 6th of February, 2018. I'll look at it properly.
No such a company.
Okay. We'll take a break here. I wanted to pick people's questions for you to address before you leave us. So let's see, we may have 1 or 2 questions that you have to respond to directly before you go. So we'll take a break. We'll be right back.